Good day. I'm Melinda Sitan, Supervising Administrative Officer of Tondo Medical Center and also the Vice Chairperson of the Technical Working Group of the Hospital Health Information Management Manual, 4th edition. With this, I will give an overview of the latest edition of the HHIM manual. The training module for this manual is still being developed and will be accessed via the DOH e-learning platform soon. The outline of this presentation is as follows. First is a short introduction of the manual developed, followed by an overview of the HHIM manual, 4th edition, and the Health Information Management Department self-assessment tool. To start, let me give you a brief description of the Health Facility Development Bureau. The HFDB is under the Department of Health Facilities Infrastructure Development Team, which is led by Undersecretary Lilibet C. David. The HFDB, headed by Director Maria Teresa G. Vera, has an administrative unit and 3 functional divisions, namely Policy Planning and Program Development Division, Health Systems Development and Management Support Division, and Research and Performance Management Division. The HFDB mandates are the following. First is to develop plans, policies, programs, and strategies on health facility development, planning, operation, and management. Second, to provide coordination, technical assistance, capacity building, consulting, and advisory services related to health facility development planning, operation, and management. And also, to advise the Secretary and the Undersecretary of Health on matters pertaining to health facility development, planning, operation, and management. We now proceed to main topic of this presentation, the overview of the Hospital Health Information Management Manual, 4th edition. This latest edition addresses the changes brought about by new mandates and issuances and updates on the practice of health information management in the Philippines. Shown here is the cover of the Hospital Health Information Management Manual, 4th edition. In 2019, this manual, together with other HFDB hospital operation and management manuals, were developed in support of the DOH HFDB Integrated Hospital Operations and Management Program and the Continuous Quality Improvement Program. Let me just give an overview of the mentioned umbrella programs of DOH, where the Hospital Operation and Management Standards manuals are part of. First is the Integrated Operation and Management Program, or commonly known as IHOMP. It is a set of guidelines to improve efficiency and effectiveness of healthcare services through creation and use of information for clinical, administrative, and monitoring purposes. Second is the Continuous Quality Improvement, or the CQI, which is the performance management arm of the National Quality Framework in Health. CQI ensures that all consumers receive the highest quality and most cost-effective health services through the development and maintenance of a qualified, diverse, and accessible multidisciplinary network, care, and service organizations. In addition, the manual supports the mandate of number 1, the Republic Act number 11223, or known as the Universal Healthcare Act, and the Department of Health's Formula 1 Plus for Health. Next is the RA 10173, Data Privacy Act of 2012, and its implementing rules and regulations. And also RA 9470, or the National Archives of the Philippine Act. On your screen are the different editions of the HHIM manual, from being a manual on medical records procedures, to Hospital Medical Records Management Manual for its second edition, and then into Hospital Health Information Management Manual for its third and fourth editions. Hence, from the 9 chapters of the third edition, this latest edition has been streamlined into 8 chapters, wherein some of it were merged as needed, and a new chapter was added, which is the Introduction to Health Record. The latest edition also defined the Philippine Health Record Standards that included medical research standards and procedures to address the gaps and define the role of the HIM department in medical research. The standards, policies, and guidelines in this manual are envisioned to serve as reference for the implementation of HIMD services and reinforce patient safety in the government and private hospitals in the Philippines. Now, allow me to share with you a brief description of each chapter. Chapter 1 presents the functions and objectives of the Health Information Management Department, as well its coordination and linkages with other service components of the health facility, vital in performing its functions efficiently and effectively. With this, the HIMD is responsible for enhancing patient care through the use of data in health record, either individually or collectively. Chapter 2 is the administration and management of HIMD, which includes the organizational structure and the 5 functions of the management processes: planning, organizing, directing, controlling, and evaluating. This chapter also includes the standard physical facilities and equipment needed to carry out the tasks in the department, as well as the standard staffing pattern, both of which depend highly on the category of the health facility. Critical in the practice of health record management is presented in Chapter 3. The discussion revolves around the different standards and policies to achieve a uniform practice for efficient and effective health information management. Chapter 4 presents the different procedures in handling and management of health records and processing of health information and issuance of certificates. It also contains a brief introduction to telemedicine and highlights the need for proper documentation in telemedicine consultations. Moving on, Chapter 5 defines the need for quality hospital statistics data collection. It also includes the characteristics of quality hospital statistics data, as well as the collection of healthcare statistics. Chapter 6 presents the health records in medico-legal, investigative, and court procedures. It discusses the ownership of the health record, accessibility, confidentiality, and investigative concerns. Chapter 7 is a new chapter added in the 4th edition of the HHIM manual. The rapid changes in the delivery of healthcare and public demand for more extended and improved health services have made electronic health records an obligation of every health facility. Hence, this chapter includes goals and principles upheld by EHR implementation, as well as an overview of electronic medical records. The last chapter covers the HIMD continuous quality improvement and risk management. This ought to strengthen the implementation of existing standard operating procedures and quality health records for continuity of care to patients and quality data on the health facility planning and decision making to attain cost-effective health record management. Another important component of the manual is the Health Information Management Department's self-assessment tool, which evaluates the compliance to standards of the HIM department. The tool is answerable by yes or no. The Hospital Health Information Management Manual, 4th edition, has been disseminated through Department Circular 2021-0274. You may access the digital copy of the manual through the link posted on your screen. Before I end this presentation, allow me also to share with you the different programs being handled by the Health Facility Development Bureau. These are the systems, programs, projects, databases being handled by the HFDB. You may reach us for more information on the programs mentioned in this presentation through the contact details provided in your screen. For hospital health information management specific queries, please email us at hhim@doh.gov.ph. Maraming salamat po.